Okay, sorry, one more time. This is the room with no charts or anything. And this is Wendy, my patient today. Okay, great. Now we're in action. Okay. Hi Wendy, my name's Lydia. I'm gonna be your nurse today.
Okay.
I'm gonna do hand hygiene. How are you doing today?
I'm fine.
Glad to hear that. Do you have any, what's your age?
I am 59.
Okay, great. So you look your age, and developmentally you are responding appropriately. And do you know why you're here?
I'm for a head to toe assessment.
Okay, and do you know what day it is?
It is Tuesday.
Great. And do you know the president?
Yes, Biden.
And do you know where we are?
At CMC.
Awesome.
Sim
So,
Lab.
great. She is alert and oriented ×4. Her skin is appropriate to her ethnicity. She looks like, how are you feeling today?
Feeling fine?
Feeling fine. And her mood is presenting, she appears to be presenting fine. Her stated mood appears to be the same. And do you need an interpreter today?
I do not.
Okay, great. Her native language is English. She's coherent. Her speech is smooth, and I can understand her. She's well groomed and looks professional. I don't have any. She appears clean and ready to go. So today we're gonna start off by just looking at your head. From the appearance, it already looks normal cephalic. It is proportionate to your body size, and I don't see any lice, dandruff, or any kind of bumps right off the bat. I'm gonna go ahead and start to feel your head. All right, tell me if you feel any pain or tenderness.
I do not.
Okay, great. And when I did that, I didn't feel any lumps or bumps, any kind of depressions or anything like that. I'm gonna go ahead and look at her face. She said, again, she's feeling fine and she appears to be calm. I'm looking for any lesions or anything like that. Everything, facial features look proportionate and equally bilateral. I don't see any twitching movements or anything like that, involuntary movements. I'm gonna go ahead and press on your sinuses. And do you feel any tenderness in those?
No.
Okay, great. So they're firm but non-tender, which is firm and non-tender, so we like that. I'm going to go ahead and have you palpate your temporal artery, and they're +2 non-bounding. And then I'm going to have you go ahead and open and close your jaw. Perfect. And so the TMJ is intact. I didn't hear any clicking or feel any clicking. It moved smoothly, and that also is an indicator that your trigeminal cranial nerve is also intact. So we're going to go ahead, just feel up those lymph nodes. As we go, we're going to do the submandibular, submental, and then we'll go down to the anterior cervical, posterior cervical, and then the subclavicle. And they are, the skin is supple, they're movable. Was that tender at all when I did that?
No.
Okay, non-tender, great. I didn't feel any enlargement or swelling of those. Great, we're gonna go ahead and move on to the eyes. As I'm looking at your eyes, I see that your eyebrows and eyelashes are equally distributed. I don't see any scaling, swelling, edema, or redness. It's the same color as your face, and they are equally proportionate bilateral. Great. I'm going to go ahead and look at their eyeballs. I'll do the eyeballs first. Just in general, they look moist and no excessive tearing or drainage. And go ahead and look up for me. Great. So I'm looking at the conjunctiva. The conjunctiva is clear, and I can see the structures behind it. It's also moist, and it's pink on the bottom, but it is white over the sclera. The sclera, I can tell already, is china white. It's no signs of like lesions or abrasions. It doesn't have any cyanosis, jaundice, or any discoloration, so that's great. For the lacrimal ducts, I'm gonna have you look down now, and I'm just gonna look at those, and I'm also going to block the lacrimal ducts here. Great, and so there was no additional drainage or anything like that, so that looks like those are appropriately functioning. I'm gonna go ahead now and look into your eye. I think I'll take a look at your cornea as well. And again, no abrasions, no opacities I can see, and they're clear. I'm gonna look at this one. No abrasions, no opacities. And the corneal reflex we're gonna do. Go ahead and just look at my pen, and I'm gonna shine it into your eyes. Great, and so those are responding. I can see the light reflect symmetrically in both eyes bilaterally. That's going to go on now to the ophthalmoscope. So we're going to check out the interior structures of the eyes, and excuse me, sorry, right to right. Don't want to end up. Okay, there we go. And let's go ahead. We have a small room back here. I'm gonna look at this just to make sure it's still in the camera vision. But it's a little bit darker, so I'm gonna be able to see better. Great. Okay. So I'm gonna go ahead and look through here. And I can see that red reflex right off the bat, and it fills the pupil. And as I go in, just going to look into the eye for that. I'm gonna make sure that I don't hit you here. Optic disc. And there we go. I can see the optic disc. And that is that creamy orange color with the cup being 1/2 the size of the optic disc. And I can see that it's, the macula is about 2 o'clock, and it's 2 DD from the macula. As I'm looking at the other structures, I see that the arteries to vein ratio is a 2:3, and I can see the arteries are just a little bit darker red than those veins, and the arteries have kind of that light reflecting off of them as well, that stream of light. I don't see them crossing. No crossing noted. Great. And I'll do it on this side as well, coming in 15-degree angle, looking into the, and I see that red reflex present, and that fills the whole pupil and it's bilateral. Oh, sorry, I forgot to do the macula on this side. Let's do the macula real quick. There we go. For the macula, I am gonna have you look into the light just for a second. Good. And I can see that macula is just a little bit darker right there. And then the background was consistent color. I didn't see any hemorrhaging or any kind of aneurysms in the fundus of that background. Okay, and now we'll go on the other side. Okay, again, that red reflex, following it in all the way to the optic disc. And then once I get that guy, there we go. The cup again, 1/2 size, the ratio, it's that creamy orange. And following the location is, I see the macula also at 2 o'clock, and it's 2 DD. The macula is 1 DD, and it's temporally to the disc. So then also looking at those arteries, or the arteries to the vein ratio is a 2:3, and the arteries have that string of light, just kind of in a brighter color. And then I'm also looking at the fundus, the retinal and the retinal background, and I don't see any hemorrhaging. The color is consistent throughout, and no aneurysms noted here. the veins aren't crossing that I can see. And that is all the background stuff. Okay, great. So while you're in the dark, I'm gonna go ahead and also do the pupil check real quick. So I'm gonna have you look at the wall behind me, and then I'll have you go ahead and look at this pen. And then the wall behind me, and then the pen. Great, so the eyes are accommodating in the pupils. Then I'm gonna just flash this in front, and I can see that your pupil is constricting. And then I'm gonna do it again with the right, so to see if we have consensual pupil constriction. Good. And then we're gonna do it on this side. Go ahead and look at that wall far behind me. And left pupil constriction. And now I'm gonna look at the right eye. Perfect. So you have direct and consensual pupil constriction in both eyes. And then we're also going to for that we have perla, which is the pupils are equal, round, reactive to light. And I'll have you look at my pen and then go to your nose. Good. So they're accommodating, and I saw the pupils accommodate as you go in. So we have that. We're going to also do the cardinal field of gaze. So 6 cardinal fields of gaze. Go ahead and look at my pen, and then just follow it. Great, so I'm looking for any extraocular movements. I'm looking to see if she has a nystagma or any kind of ptosis in her eyes. Great, and I don't see any extraocular movements. Both of those tests, the perla and the 6 cardinal field of gaze, are testing for cranial nerve 3, 4, and 6, and those are intact. Great, come on out. We'll just reposition here. While we're on the eyes, we're going to go ahead and do the Snellen chart. So, before I forget, while you're standing, this is perfect. We're going to do the peripheral check with your eyes. So go ahead and cover one eye. So we're going to be testing the left eye first. And tell me when you can see my hand come into view.
I see it.
Okay.
Yep.
Yes. Good.
Yes.
Okay. And we're going to do the other side. Yes. 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 Good. So peripheral vision is intact, and that plus the Snellen chart will be testing your optic nerve, cranial nerve 2. So go ahead and just stand back there about 20 feet, where that line is, and cover your left eye. Great. And go ahead and read the lowest line you can.
LEPODPCT.
Okay, great. And then go ahead and switch the other. And then go ahead and read the lowest line you can.
EDFCZP.
Great. So that's 20 out of 30 on your, this is your left, and then it was 20 out of 40 on your right. Great. And then can you tell me what color this is?
Green.
Green. Okay, good. That is correct, and you are able to tell the colors, so that's wonderful. So with that, we were able to tell your cranial nerves. Cranial nerve number 2. Great. All right. We're gonna go ahead and move down to your ears, or over to your ears. So I'm just gonna pull your hair back. I'm looking at your beautiful ears. They don't have any scaling, redness, edema that I can see, and they are the same color as the rest of your skin, so they're homogeneous in color. I'm looking for any exudate, any kind of drainage, and then I'm also going to look at their position, which the pinna is lateral with your eyes, and then I'm also looking at the positioning, which is 10 degrees vertically. So they look proportionate to the rest of your body, proportionate to your face. I'm going to go ahead and do the tug test, which is just pulling up a little bit. Tell me if you feel any pain.
No.
Okay, and
Nope.
Okay. She doesn't have any pain or tenderness. I'm also going to do that again, but also pushing on the tragus, helix, and the mastoid. And you just let me know if you feel any pain in those. No. Great. Negative tenderness or pain. I'm going to go ahead and look inside your ear, and we'll see if there's anything going on in there. Wrong side. Whew, I'm nervous. Okay. Here we go. So as I'm coming in, of course, going in, we're going to pull up and back, and then also keep this at an angle so I don't accidentally hurt anything in there. As I'm looking inside, I'm going down. I don't see any foreign bodies. I see that the mucosa is a light pink. There is not an excess of earwax or serum, and there's no drainage, swelling, edema, anything like that. I'm now looking at the tympanic membrane, and it's coming back pearly gray, and it's intact. It's not perforated or anything, and it's mobile. I also am looking at the cone of light, which is in the inferior quadrant, and coming back at 5 o'clock on this side, because this is, 7 o'clock on the left side. Perfect. And then we're going to do the same thing on this side. Again, looking for any foreign bodies, any swelling, signs of infection, signs of obstruction or perforation, and I see none. Looking at that cone of light again in the tympanic membrane, it's not perforated. I see the cone of light in that inferior quadrant, and on the right side, it's coming back. The cone of light reflects at 5 o'clock. And no excessive earwax, so that's great. We're gonna do the whisper test real quick, just to see if your hearing and auditory is intact, and I will also test cranial nerve 8. So go ahead and cover this, and I'm gonna stand 2 feet behind you, and I'm gonna whisper 3 letters, and you tell me what letters those are. A, D, C.
ADC.
Great. And then go ahead on the other side.
ABF.
Great. So that's a passing score of 6 out of 6. And your auditory cranial nerve is intact. Number 2. Great. We're going to go ahead and move on to your nose. Let's get this again. As I'm looking at your nose, I already see that there's no swelling, edema. It's the same color as the rest of your face. It's proportionate to your face. I see that you're not having difficulty breathing. You're not labored breathing. And I don't see any exudate, drainage, blood, or anything like that coming out, or foreign bodies from the outside. If you don't mind, go ahead and close up one nostril and breathe in and out. And then do it on the other side. Great, so it's patent in both nostrils. And I'm gonna go ahead and look. There we go. And if you just tip the head a little bit back, great. I'm just looking for any signs of obstruction, or maybe a super dry mucous membranes or anything like that. Blood, foreign membranes, air, swelling, edema, anything like that. And I'm also checking for the septum, and I don't see a deviated septum, and negative for any of those features I just mentioned. And the mucosa look pink and moist, and no obstructions are found. Looks great. Yes, sorry about that. One other thing I'm going to do is have you close your eyes, and I'm gonna have you just smell and tell me what this smells like.
Alcohol.
Good. So that's cranial nerve 1, and it is alcohol. It's hand sanitizer, which is alcohol-based thing. Cranial nerve 1 is intact. Great. hand sanitize my gloves. Okay. I'll hand sanitize my hands. We're gonna go ahead and now move on to the mouth. The mouth looks, right off the bat, I don't see any movements, drooping, signs of potential stroke or anything like that. I see that your lips are moist, they're slightly darker. I don't see any lesions, any bumps, or any cleft lip or anything like that. I'm gonna have you go ahead and put on some new gloves, and then we'll be looking inside your mouth. But for a second, can you smile, frown, puff out your cheeks? Good. Close your eyes, and then lift your eyebrows. Great. We're just checking for those movements of the face, and that covers cranial nerve 7. And then if you want to go ahead and go open your mouth, stick out your tongue. Okay, cranial nerve 12 is intact, hypoglossal. And then if you can go I see the uvula, it's midline, and then it rises upon phonation midline. We can do that again here. Do that one more time. Okay, great. So cranial nerve 10 is intact. And then go ahead and swallow for me. Good. Okay, cranial nerve 9 is also intact. I don't hear any hoarseness in her voice. I'm also looking at the palate. It is white on the front, a whiter color with those ridges, and then it gets soft and slopes downward in the back to that soft pink. It looks moist. All of her membranes in here look pink and moist. I don't see any signs of decay or caries, any signs of excessive debris, patches of white, or any sort of infection. Her teeth are evenly spaced and white. They go ahead and clench down for me. Good. They appropriately sit on each other, no overbite or anything like that. And we already did the clench with the TMJ, which of course is part of that cranial nerve as well. Good. I think we're done with the mouth. Let's go ahead and move on to your chest, which I totally forgot to ask you for a there's one right there. Stethoscope. Oh, stethoscope. Thank you. Perfect. Thank you. Got our stethoscope here. Gonna listen to your lungs. As before we get started, I'm just looking at your chest and your cage and everything. I'm looking that you don't have a barrel chest, any signs of deformities, I don't see any. The anterior posterior is going to be less than the transverse, so that looks good. Doesn't look any signs of capturing that inhale and not being able to let it go, which is good. You're breathing in a steady rhythm, no labored breathing, and so those are all good signs. Do you have any trouble breathing right now?
I do not.
Okay, great. I'm gonna go ahead and now listen to your lungs. And you're just gonna take a breath when at each point. So go ahead and take a breath. And again. Good. And while we're here, I'm just gonna go ahead and listen to the heart. This is the pulmonic. Good. And listening to the aortic. Okay, go ahead and take a breath. And a breath. Okay, and you can just breathe normally. I'm gonna listen to the tricuspid. Okay, excuse me, I'm just gonna listen down here. Go ahead and take a breath. And another breath. Good. We'll do it laterally. Good. Anteriorly, all the fields are clear and no advantageous sounds I heard. I'm going to finish listening to the heart down here. Just hold with me. The mitral valve. And then I'll also be listening to the apex of the heart for 1 minute to hear your beat. We'll do it for 30 seconds and I'll double it. All right, great. So I got 60 beats per minute, just a normal, within range. And we would have done vital signs at the beginning of this and made sure that those align. I'm gonna go ahead and continue with the lungs. Also, while listening to your heart, I heard S1 and S2. No signs of any murmurs, or S3 or S4.
That sounds good.
So it's good. I'm gonna just do a bilateral expansion down here, so take a deep breath. Great. We're gonna do it as well as posteriorly. Take a deep breath. Great. Equal bilateral expansion anteriorly and posteriorly. And I'm gonna finish listening to the back of your lungs here. Go ahead and take a deep breath. Great. And so those are equal bilateral throughout. No advantageous sounds found, and she is breathing well. Normally in practice, we would have had you remove your clothes so that we could get even a closer listen, but due to the simulation, it's okay to leave your clothes on today. We're gonna have you lay down for the abdominal. I think we could just go in here, or where would you like to go?
Mm-hmm.
All right. I will bring the camera and make sure you can see that everything is good. I'll bring the reflex. So there's no notes. This is also a just normal room here. Do a little 360 view. Okay. Okay. Great. So we're gonna do the abdominal test assessment now. So is it okay if I just move your shirt up a little bit, or would you like to keep that on?
Nope, that's fine.
That's okay. Okay. So as I'm looking at the contour. I can tell when I look aligned. It's just it's flat. It looks. The skin doesn't have any lesions. There's no bulging. I don't see any striae or any kind of rash, redness, or scaling of the skin. It is consistent with the rest of the body, and I see just a slight pulsation above the umbilicus, this umbilical, which is a normal finding, just because that aorta vessel is right there. Her umbilical is inverted, and I'm gonna go ahead and listen to the renal, the iliac, and the femoral arteries. As I'm doing this, I'm listening for any roots, and I would do that as well down there. And of course, I do not hear any roots at this time. As I'm going to go ahead and also take and listen to her belly sounds in all 4 quadrants. So start down here. So normal active sound, bowel sounds active and present in all 4 quadrants. And I'm gonna just do a light palpation first. So we're gonna press down, and you tell me if you feel any pain or tenderness, guarding, or rigidity. We'll all feel for rigidity. Good. Okay, and then we'll do a deep palpation. And And I'm just feeling for any kind of splenomegalia, any kind of bumps or rigidity. She's not guarding, which is great. Great. And no pain or tenderness.
No pain or tenderness.
Great. Okay, and we're all finished with the abdomen. Looks good. Let's go ahead. We're going to move on. You can go ahead and sit up. Or actually, you can continue lay down. Sorry. I'm going to do the extremities.
Okay.
Since you're already laying down, we'll do the bottom and then we'll do the upper extremities. But since we're laying down, we can do the range of motion a little bit easier.
Great.
So I'm going to move your leg passively to test your passive range of motion, and then you're going to do it yourself. So I'm going to pull it up and feel, as I'm doing this, I'm feeling the joints for any crepitus or anything like that. Good. And we'll go ahead and do the other one as well. And then I'm just going to move your knee a little bit and in and out. Great. So passive range of motion is full, complete passive range of motion. And then I'll have you do those exercises the same thing with your knee up to your chest and then out and then back in. And then can you move your knee up and down? Great. Any pain or anything like that?
No.
Restriction. Great. And then go ahead and put this foot down. And then can you move your ankle side to side? And then frontwards and backwards? Great. And then I'm going to do and then go ahead and do that on this side. Great. Up and down. Awesome. And then put that down. And then we're testing your ankles back and forth. Okay. Great. So active range of motion is full as well. We're going to do just a little bit more. You're going to push against my hand now. Awesome. And again against. And then with your foot, pull towards you and then push down. Good. And then this thigh. Okay, and pull up on that. Great. And then pull towards you and push down. Good. And then I'm also testing reflex Babinski sign and negative for both the Babinski sign, the toes curled down. So that's great. If you'll sit up for me now, we're good with that. I'll have you just bring I just want to make sure the camera's still got you. Okay. And then with the calves, just pull towards you. Good. And pull towards you, and then push away. Good. Okay, so full range of motion and resistance 5+ with resistance on the lower extremities. And as I would look at your skin, making sure there's no edema or signs of any sort of maybe blood clot swelling, abnormal discolorations or pooling down here. No edema present. I'm also going to check those pedal pulses, the posterior dorsal, the posterior tibial, and then the dorsalis medius. And both of those are +2 non-bounding. And then I check your cap refill, less than 3. And looking at your toes as well for enhance for any clubbing of the fingers or perfusion difficulties. I'm gonna go ahead and now do the same thing kind of with your upper extremities. Go ahead and we'll do passive range of motion. So I'm just gonna check your shoulders here, and then we'll do your elbow, and then wrist. Great. And shoulder, elbow, wrist. So she has full range of motion, no clicking or crepitus in those joints. And then you can, if you would, just do a circle, and then forward. Good. And then over the head like an O. Awesome. And then see if you can touch your hands in the back as high as you can go. Good. And then over your head, touching. Okay, wonderful. So she has full active range of motion as well. And then we're going to check resistance and strength. So go ahead and put your arms like this, and then you're going to pull towards me. Good. And then pull towards me. Good. And then go push, push, squeeze my fingers. Good. And then we're going to do a handshake and squeeze as hard as you can. Good. Okay. +5, strengthen your wrists, elbows, and shoulders. We're going to check your pulses. Brachial pulses, +2 non-bounding, and also your radial pulses. I'm going to check for cap refill, which is less than 3. And I'm looking at our fingers, no deformities or swelling in the joints that could indicate maybe arthritis or some type of difficulty in joint movement. I also am going to go back up to your neck because we forgot to do the neck. Looking at your neck, it is midline, and I don't see any signs of deviation or goiter, any kind of enlargement. The neck is the same color as the rest of the body, no lesions or indications of I don't know, difficulty breathing. I'm going to go ahead and palpate your carotid artery as well. +2 non-bounding, +2 non-bounding. And we already checked your lymph nodes. Those are non-tender, those are supple. And you did your swallowing, which is the cranial nerve that was intact. So I think we're good on the neck. Great. Okay, we did the top extremities, lower extremities. I'm going to do a couple tests now as well to do, let's just go through all the cranial nerves. We already did the smell, we did the eyes, we did cranial nerve 2 with the Snellen chart, we did cranial nerve 3 with the 6 fields of gaze, 3, 4, and 6. We did 5 with the TMJ, 7, we did the, actually 7 is the facial touch. So let's just go ahead and close eyes, and I'm just going to, can you tell me what side that is?
Left side, right side.
Great.
Forehead, chin.
Good. So facial sensation is intact. And then 8 was the listening, 9 is the swallowing, and 10 is the vagus nerve, which is the uvula. We already did that with the 11, we're going to go ahead and shrug your shoulders up. Good. And then look this way, and then the other way. Good. And let's do it again with resistance. So can you look this, yeah, towards my hand. Perfect. Thank you. Great, Wendy. Cranial nerve 11 is intact, and cranial 12, which we looked at the tongue earlier, comes out midline, no movements. And if you want to do that again, I'll just, perfect. No tremors or anything like that. Okay, the cranial nerves are all intact. We're going to go ahead and do a couple, let's do the reflexes. So I'm just going to have you, relax your arm. That's great. And then I'm going to, good. So we'll do bicep one. And then we'll do this guy. Good. And then, good. And now we'll do the legs, the quadricep. If you want to scoot out just a little bit more, I'll go behind or in front. Good. And then we'll do the Achilles. So all of these so far have been +2, bilateral. Great. And so all your reflexes are +2 bilaterally intact from upper extremities to lower extremities. Okay, a couple final fun tests we get to do. We're going to test your cerebellum function. So first I want you to just use your fingers and do rapid movements touching each finger to your thumb. Great. And then we're going to do touching your nose to my finger. So use your finger and touch my finger, and then touch your nose. Good. And as we do that, I'm going to start moving my finger. Good. Wonderful. Okay, and then I'm going to have you do one more time, touch my finger to your nose, and then I'm going to have you do it once with your eyes closed, but I'm not going to move my finger.
Okay.
Wonderful. Okay, so she does these movements smoothly and accurately. You're able to complete them. Go ahead and then do the shin. Yes. You're going to use, the heel, and you're going to drag it up your shin and then back down 3 times. Okay. And then go ahead and do it on the other side. And the movements are smooth. She didn't do it with hesitancy, and she can complete that without problems. So we have the cerebellum functioning intact. We're going to then do go ahead and stand up. We're going, I think we can go on this side. Yeah. And you go ahead and you can either stand over here or there. And I'm just gonna watch your gait, and she's steady on her feet, and then walk tandemly, which is walking in a line, this line right here. If you could walk back and forth. Wonderful. Okay. And then can you do it heel to toe on the way back? Great. So she smoothly and accurately is able to tandem walk. Her gait is steady. Then I'm going to have you close your eyes. And for 20 seconds, I'm just going to make sure you can stand. I'm seeing that her movements are steady and she's not swaying. And she's able to maintain posture and balance. That's great. I'm going to have you now close your eyes, and I'm going to use a key to do a pain test, which is going to be, one is going to be sharp, this is going to be sharp, and this is going to be smooth. Is that good?
Yes.
Okay, so I'm going to test that now. Sharp. Sharp. Smooth. Smooth. Sharp. Sharp. Okay, great. And then we're gonna do light sensation as well. And this is just going to be, I don't have a cotton ball right now. Do you have a cotton ball?
I do.
Oh, okay, great. Sorry, I forgot about the hot ball. Oh, wow. Okay. Oh, my hands are sweaty. And just let me know where you feel this.
On the back of my hand, on my cheek, on my neck, on the underside of my hand, on my calf, on my right calf.
Okay, great. So your soft sensation as well is intact. Go ahead and close your eyes, and I'm gonna put something in your hand. You're gonna tell me what it is.
A key?
Great. So she is able to identify things in her hands without looking. So we did, I think, almost everything. We have done everything I can think of. So thank you, Wendy, for participating today. And I think you are in good health.
Great, thank you. That was a perfect exam.
Oh, wow, okay. Thank
We'll
you.
see.
Thanks, Wendy.